staff on the front line and taking the calls of these delays.
And good morning, everybody. It's absolutely having a devastating impact on our members. Frustration, stress, burnout, exhaustion, low morale, mental health. Our members are tired of going to work every day and in some cases spending the whole of their shift sat on an ambulance outside an A&E department with the same patient. We've had examples where our members have clocked off at the end of one shift to return the following day to the same patient being on that ambulance with the crew they'd left them the night before. Now, our members went into this profession to become healthcare professionals to help the public and provide patient safety. They feel they are being physically prevented from being able to carry out their jobs today, and that is because of this knock-on impact with handover delays and waiting times, and the fact that patients can't be safely discharged into hospitals, and when they eventually get to a job that they can see on the monitor somebody has been waiting hours and hours for this call, they don't know what situation they're walking into. They don't know if that individual will still be alive. They have friends and families that are screaming at them as if it is their fault. And these are the very individuals that are not to blame for this situation. So our members have taken the steps that they've taken to vote for action, and this is one of the central parts as to why they are doing this, because we have been raising these issues for years and we have been ignored. As early as last year, we wrote to this committee and we had a very supportive response, but we wrote with a copy of a letter we sent to the government highlighting we've come out of the pandemic, we're heading into the worst winter pressures that our members are reporting to us. And it fell on deaf ears. Nothing was done, and those issues are even worse now. So our members are exhausted. There's the highest sickness levels amongst all category of workers in the NHS in the ambulance service, and that is because of the terrible conditions they are being expected to work in. And this isn't just the frontline paramedics, technicians, emergency care assistants. This is the call centre people that are having to deal with this influx of calls and screaming family and friends that are frustrated, and the massive increase in mental health calls that they're having to deal with because there are no, or they've been significantly reduced access to community and mental health services. So the whole impact across the workforce is massive, and our members are pleading on the government to do something about this now.